Whether you're working 100 miles offshore, in a busy port, or building the vessels that support our way of life, we salute you. John Deere is proud to support you in these challenging times. Thank you for staying on the job, keeping the world supplied with food and goods while inspiring us to help each other however we can. We're in this together, and we're proud to help you keep powering ahead.
Hello, everyone. Welcome. I'm Jessica Hathaway. I'm the editor-in-chief of National Fisherman. And joining me today is Dr. Ann Jarris, who is the co-founder and chief executive officer for Discovery Health MD. She's a board-certified emergency medicine physician in Seattle. Dr. Jarris has expertise in remote medicine and telemedicine. She's seeking to integrate innovative technologies into healthcare and to drive health information into the hands of the consumer. Welcome, Dr. Jarris.
Thank you and good morning.
Thanks for joining us. So Dr. Jarris also, I wanted to note, presented an incredibly informational and supportive webinar for us called Developing Vessel Procedures and Performing Symptomatic Crew Assessment in the Midst of COVID-19. If you're watching this video on nationalfisherman.com, you can look just below to find links to the webinar, as well as links that Dr. Jarris provided in the webinar for more information on this topic as the season progresses. Now, in the webinar, we did cover what we could for Q&A, but we wanted to make sure we got to more of the industry's questions on operating commercial fishing boats this season in the midst of COVID-19. So we're going to get to your Q&A, but I heard, Dr. Jarris, that you started some testing. So can you talk to us a little bit about that?
Thank you. Yeah, we did. So last Tuesday, almost a week ago, we launched our COVID-19 testing program. We've been working in collaboration with the University of Washington, and we've started testing within the fisheries with a nasal swab PCR test and a venous blood antibody test. We've tested over 500 people so far, some very interesting results, and we're ramping up to test more and more before the season starts up in Alaska. Unfortunately, today we can only do this in Seattle, but we're working on options for remote testing, and hopefully over the next week or so, those will continue to develop.
That is very exciting and definitely good news to hear. So the first question I wanted to start with is actually not one that came up in our Q&A, but in some other Q&As that I've seen recently. And that is a question about Medevac insurance. I heard some people asking about the requirement to check in with a local clinic first before being Medevaced out of a remote area or with an injury. Can you talk a little bit about what that means for this season?
Sure, that's a multi-layered question, and it starts to get out of my experience range because we start to talk about insurance companies. So I will talk about my experience, but whatever I say, you should verify with whoever you purchase Medevac insurance through what their requirements are. So generally speaking, if somebody gets sick on a boat and you want to bring them to shore without involving the Coast Guard, you're going to bring your boat into a local community. You should call the clinic and let them know that you're coming in. Give them the option to decide if they want to come out and meet your boat at the dock to evaluate the person, or if they want you to bring them to the clinic. There are a couple reasons for that. The first is to make sure that the person is stable for transport. Since you have access to medical care on shore, you should use that to make sure that the crew member is stable for some form of transport. But in these strange times, you should give the clinic the option of how they want that person to be evaluated. Then if the clinic feels a Medevac is indicated, they can call. They're going to need to know who your insurance is, so they can contact the insurance to figure out who the preferred carrier is, and then they can make those arrangements. The concern of bypassing the clinic, the concern of just taking a crew member to a Medevac, is that number one, you want to make sure the person is stable. Number two, the insurance company is going to want to make sure that the Medevac was medically necessary. And that's the part that starts to get outside of my expertise. Because when the Medevac company reviews, when the Medevac insurance company reviews the appropriateness of the Medevac, they're going to want to know that it was medically necessary. And that decision is oftentimes needs to be made by a medical professional. And oftentimes they'll have to provide documentation to support that. So I think the smartest thing to do is, one, to understand your policy, to understand what's included and what's excluded. Many policies say you have to call the policy first to determine who the carrier will be. Oftentimes they'll have preferred rates. So don't just call a Medevac carrier and think everything's going to be okay. Make sure the insurance is aware of what's going on. And then lastly, really just involve the clinic in any medical event that's happening on their shore.
Okay, that's great advice. It's important to keep in mind that we are not medical professionals when we're on board, unless we have a degree. You have to make a call and communicate, as we learn is the key in most emergency situations. Okay. So speaking of medevacs, there are often other injuries on board in a fishing season. So what do you suggest for protocol for dealing with non-COVID related injury or illness on board during quarantine or in a lockdown rural community?
And that's been a really interesting issue with our international vessels, where countries are refusing to allow people off for medical care. So this is becoming a very real problem, that if you have a non-COVID related issue on board, it's getting harder and harder to get shoreside medical care. So if somebody is injured on board or has a non-COVID related issue, you'd end up going through your normal procedures. And whether that's you're calling the Coast Guard, whether you're calling a clinic, whether calling a personal doctor, or whether you're calling a medical advisory service like ours, you'd follow that usual procedure. The difference is oftentimes, how do we manage that on land? So even in the quarantine period, if something happens, you still need to address it through your normal channels. But how that person, if they need to get to land, how that person gets to land is oftentimes going to be a case-by-case basis, depending on where you are and what resources are available.
Okay, great, thank you. So what are you, I know that you've been in touch with a lot of people who work and fish in Alaska. What are you hearing from Alaska community members about the season?
Still a lot of fear and chaos. There's a lot of moving parts right now. And with the season having just started and people actually showing up, I think we're starting to live into the reality of it. The positive side is that most of these communities do have access to testing. They do have access to point of care testing at the clinics. So there's more and more opportunity for them to use it. There's still a lot of concern that people aren't going to follow the recommendations and that people are going to ignore their requests for social distancing and good hand and cough hygiene. So I think we're going to see over the next couple of weeks how it goes. If people really take this seriously and are considerate and respectful to the local communities, I think we'll be okay. But if people don't, then I think the season's in trouble. So it really comes down to how people behave and interact with the local communities.
Yeah, right, as usual, but in a more intense way this year. Can you elaborate on any changes to healthcare delivery and or capacity in Alaska in response to the pandemic?
People have been definitely ramping up. A lot of the local shore processors have been adding medical staff. The clinics are certainly ramping up as much as they can. So people are certainly expecting an increase in medical cases and are definitely ramping up their capabilities. Hopefully those will be sufficient. Hopefully we won't have large volumes of sick people overwhelming those capabilities, but every stakeholder has been working together between the companies and the clinics and the Medevac companies and destination hospitals. Everyone's really been working together to have contingency plans in place.
That's good to hear. So what sources do you recommend for PPE, for protective equipment? Someone in the chat recommended the Alaska Manufacturing Extension Partnership. I believe it's based in Anchorage. Have you been working with any of these groups?
This is really beg, borrow, and steal time right now. I've reached out to every single person I know who has access to PPE in order for us to source it. And I get what I can from the sources that I can. So unfortunately, I don't have a great answer for this. I would essentially call everybody you know who may have access to PPE in order to see if anybody has anything extra that they're sitting on. But there is still not a consistent centralized source for that. It might be good if we can share that, if we can kind of crowdsource that information. And I don't know if this would be a good forum for it, but if people are finding places where they're getting masks and gowns and gloves and face shields and such, I think that would be really helpful if we had a clearinghouse to share that information on.
Yeah, absolutely. So we will definitely be updating this story and other posts with information about that as it comes to us. I definitely would recommend reaching out to your association, your fishing association, or local, the town council, or any other local representatives that you might know who might be able to bring in emergency supplies for the community. Okay, so let's talk about the supply chain. We had a couple of questions about this in the webinar, and I know people are concerned about the rules, following all the rules for getting fish from the boat to the tender and to shore. So can we just talk about that supply chain before the product meets the dock? So boat to tender to shore, what should that look like right now?
Do you mean in terms of how people should be handling product and what precautions they should be taking?
Right, handling product, how can they interact to, like, what are the parameters for interaction in terms of transitioning the product to shore?
And again, I think once you do this a couple times, and we talked about this, like running a safety drill, just run through this process. Once you sort of learn these habits, that muscle memory is very easy. But the first few times you do it, it's very confusing. So it's almost worth running a drill, having somebody read through the process while everybody goes through the drill. So somebody reads, okay, the tender's coming. Everybody dons their gloves, their face masks, their eye protection. Product comes on board. Disinfect what can be disinfected. Maintain your 6-foot social distancing. Ensure everybody is wearing a mask. After the product comes on board and is disinfected, remove your PPE and perform hand hygiene. So I think if people use the guidance and actually use it to do drills once or twice, the fundamental concepts are really simple. I mean, it still comes down to social distancing, disinfecting what you can when it comes on board, performing excellent hand hygiene, washing your hands after you touch anything that's potentially contaminated, not touching your face, and using appropriate PPE. Once you sort of learn those skills, that's applicable to everything you do, whether it's getting product from the tender, whether it's dropping it off at the dock, or whether it's even being around town. It all comes down to those basic principles.
Right, and so it's important to note that fishermen are typically not wearing neoprene or nitrile gloves. They're wearing, Atlas gloves, heavy duty gloves. So don the gloves, but make sure that those gloves have been washed and are clean before you interact with any other boats.
Correct. So after you're done receiving product, you should wash your gloves. And again, you can wash your gloves with soap and water. You can launder them, but you should wash those gloves as well if you're going to reuse them. And then once you take them off, you need to wash your hands.
Right. Okay. And also, in terms of running the drill, should fishing boats under quarantine be potentially running drills with the tender they're going to be delivering to?
You certainly could do a mock drill with them, but again, make sure that you don't break your quarantine. Make sure that you're at least 6 feet away from everybody and everyone's wearing masks. But yeah, I think it's a good idea to sort of run a mock drill with your tender just to make sure everyone's on the same page.
Okay, great. All right. So let's just take a tiny step outside of Alaska here for a minute. Are you seeing health mandates coming from states other than Alaska?
I haven't yet. I don't want to, but if they're coming, I'm happy to take a look at them and try and understand them. I think Alaska's just been such a high volume of people in a short time with such limited medical resources that it's really forced them to go down this road. But I personally am not aware of other states' health mandates. That doesn't mean they don't exist. I'm just not aware of them.
Right. Okay. So one very specific question I had from someone I know who is very hands-on and likes to take things into his own hands and is in a remote part of Alaska, is chlorine dioxide, ClO2, he says, an effective sanitizer for COVID?
Offhand, I don't know.
Okay.
There's really, the CDC and EPA have really good lists of what is approved and what's appropriate. and how to use them. So I would refer them back to that CDC guidance and the EPA guidance on the appropriate disinfectants and sanitizers against COVID.
And that was in your list of informational links, right? Which will be below.
Yeah, and if you go to the last part of the guidance document, the footnotes will have links to the CDC website and the EPA websites that have that information.
Okay, great, thank you. So we covered this a little, I believe, in the webinar, but I just wanted to reiterate that, this is a difficult time for talking about mental health and taking care of ourselves in this time. What suggestions do you have for things that we can do as communities around fishermen, but also fishermen themselves, to make sure that they are taking care of themselves mentally and physically right now?
I think the first thing to do is to validate how stressful this is for everybody. People are still trying to manage as though life is normal. And I think if we can take a step back and recognize that what we're trying to do is, it's an epic challenge to pull this off. So if we can be kind to each other and say, we recognize we're all under stress, we recognize this is difficult, but we also recognize how important it is. It's like even going to the grocery store right now is like combat. And you have to be calm, and you have to take a step back, and you have to be forgiving to people. We have a saying in emergency medicine: move slow to move fast. If things are stressful, rather than just trying to rush through it and get it done, kind of take a step back and take a deep breath and keep your 6 feet of space, stay calm. It's not an emergency. We'll get through this. So I think first, validating and recognizing how much stress we're under, validating and recognizing the concerns of the local communities. They have very, very valid concerns. And I think most people are going to be respectful of that, but I'm fearful of people who won't, because that's going to ruin it for everybody. So in terms of your mental health, it's number one, cutting yourself some slack, realizing this is crazy and this is stressful, and that we're all in it together to help each other. Communication with people at home is going to be very, very important. So figure out who your support network is, figure out who are the positive people in your life that give you energy, and lean on them. So leaning on your support network and making sure those lines of communication are open are going to be very important. This is an incredibly stressful time for seafarers everywhere, people whose crew contracts have been extended, who don't know when they're ever getting off their vessels. It's a mental health disaster right now. So anything you can do to figure out what your support network looks like, what it is that you do to get support, and make sure that that's available to you during this season. But more than anything, just forgive yourself and cut yourself some slack. This is a hard time for everyone.
Yeah, that's great advice always. And in my experience, really hard for fishermen to do, especially running the boat. They have, they take a lot on themselves, and it's an intense and high stress job any day of the week. So I think it's really, really critical to note that it's only going to be more difficult this year, and it's important to try to keep that in mind at every turn, really.
And along those lines, fishermen tend to be very independent people who don't oftentimes like to share information. And I think that this season, it would be wise to help each other out. If you find a procedure that works really well on your vessel, if you have sources on PPE or hand sanitizer, I would really encourage you to share. I mean, we're all in this together right now. So it's been interesting watching such an independent group of people actually come together and help each other out. And I would like to see that continue this season.
Yeah, that is an excellent point. And I would definitely like to echo that fishermen are independent, and they do have a reputation for not always working well together, especially in forced scenarios. But what I've seen from fishing communities in response to this pandemic has been really incredible and inspiring and unparalleled, really. I haven't seen anything like this anywhere else. And I want to thank you again so much for taking time out from what I know is an incredibly busy season for you in trying to help everyone get prepared for this transition into the fishing season in the midst of a pandemic. So thank you so much, Dr. Jarris, for joining us again. And I hope that we'll see you again soon.
My pleasure. Thank you.